SLPA Training Module, the role of the speech-language pathologist. This module is designed to provide information and guidance for speech-language pathologists who are supervising speech-language pathology assistants. The supervising SLP should view this module and document completion of the module on the supervision plan. A module is also available for speech-language pathology assistants, which also must be completed and documented on the supervision form. We want to start by thanking you for your dedication and your professionalism, for your contribution to the speech-language pathology field, and for the quality services that you provide to students in West Virginia schools. We, like many other states, have a shortage of speech-language pathologists working in the school system. According to data submitted by special education directors in December 2018, there were 76 speech-language pathology vacancies statewide, and contracted therapists were being used in 40 of 55 counties. Those vacancies affect nearly 3,500 students. That being said, we were serving over 21,000 students. So we need additional therapists, and one of our options is to use SLPAs. In order to supervise an SLPA, the speech-language pathologist must have a master's degree, be certified through the West Virginia Department of Education, have an interest in supervising an SLPA, having practiced for at least 2 years following certification, and it's recommended that you have at least 2 hours of continuing education in supervision. In order to provide adequate supervision so that the quality of services is maintained, the supervisory responsibilities of the SLP will increase. That means their caseload and other responsibilities must decrease. Remember, the SLP is responsible for the SLPA's caseload as well as his or her own. Therefore, the supervising SLP and the special ed director should mutually agree on the supervisory responsibilities and subsequent reduction of the SLP's workload. As the supervising SLP, you have responsibilities first to the students and their families. You retain the legal and ethical responsibility for all students served by the SLPA. You're the one who communicates with students and the family members about diagnosis, prognosis, and the IEP. And along the way, you should inform families and school staff about the level, meaning professional versus support personnel, frequency and duration of services, as well as required supervision. You are the representative for the speech-language pathology team in all collaborative, professional, IEP, interagency meetings, correspondence, and reports. This does not preclude the SLPA from attending those meetings and even writing up draft IEPs, but you are the ultimate face for the speech-language pathology team. You also make all the clinical decisions, including determining student selection for inclusion or exclusion in the caseload and dismissing students from therapy. You would conduct the diagnostic evaluations, assessments, or appraisals and interpret obtained data in reports. You would be the one who would discuss the case with or refer the student to other professionals. And of course, you participate in the development of the IEP or make modifications prior to or during implementation as appropriate. Even though the SLPA may write the progress notes, you review and sign all of them. Your responsibilities to the SLPA would start out by your providing orientation to them by reviewing IEP goals and modeling strategies and techniques for each of the students on their caseload. So you would review each IEP with a speech-language pathology assistant and make sure they understand the goals and the activities. Throughout the year, you would coordinate ongoing training to the speech-language pathology assistant on the job. Like if you see they need information on a particular technique or a strategy or a new thing to try, you would be responsible for that. And you're the one who's responsible for delegating specific tasks for them to do. which means you also are responsible for making sure that they don't do things that they shouldn't do. It's important that you provide and document appropriate supervision of the speech-language pathology assistant, and that you provide feedback to them regarding performance of duties and responsibilities. This way, you're ensuring that the SLPA only performs tasks within their scope of responsibility and/or their skill level. When updating the guidance document for SLPAs, we utilized as many of ASHA recommendations as we possibly could. We're going to show you those in red, and the guidance document recommendations are in gray. ASHA states that the supervising SLP retains full legal and ethical responsibility for the students he or she serves, but may delegate specific tasks to the SLPA. You'll see in our new supervision plan that the supervising SLP agrees to that basic kind of responsibility, and that even though caseload assignments will be made to an SLPA, on paper, the ultimate responsibility for that caseload is with the SLP. ASHA states that the purpose of the assistant level position is not to significantly increase the caseload size for the SLP. Our guidance document encourages a reduction in the caseload of the SLP and also emphasizes that the ultimate responsibility of both caseloads is the SLP's. ASHA recommends that the SLP supervise no more than 2 SLPAs. For now, West Virginia is permitting the supervision of 3 SLPAs. ASHA recommends that when the SLPA starts, that they should receive 100 hours of supervision. This is important because when you consider that a lot of the students who come from an undergraduate program have not had a lot of experience in therapy. So ideally, the SLP and the SLPA would work together, perhaps sharing schedules for a week or two until the SLP feels comfortable that the SLPA knows, what should be done with each of the students. Recognizing this, at a minimum, the guidance document states that during the first 90 days, this SLPA should receive 20% direct supervision, or that would be 18 weeks times 7 hours based on a typical work week, or 126 hours direct supervision. That's at a minimum. If at all possible, if it can be worked out schedule-wise at the beginning of a school year, that more supervision can be provided, it's really a lot better. ASHA goes on to say that during the first 90 days, there should be at least 30% supervision, including at least 20% direct and 10% indirect supervision weekly. Direct supervision of student services should be no less than 20% of the actual student contact time weekly for each SLPA. The guidance document basically recommends the same thing. After the first 90 work days, the amount of supervision can be adjusted if the supervising SLP determines that the SLPA has met appropriate competencies and skill levels with a variety of communication and related disorders. In our guidance document, we recommend a determination of the SLPA's independence with tasks after the first 90 days, and you would see the level of supervision and instruction form to do that. According to ASHA, the minimum ongoing supervision must always include documentation of direct supervision of services provided by the SLPA to each student, patient, or client the SLP works with, at least every 60 calendar days. In order to fit with the flow that takes place in the school system, we've broken this up into progress reporting times. And each progress reporting period, the SLP would complete and observe each of the students seen by the SLPA, and this would be documented on the direct observations of students assigned to SLPA form. ASHA recommends a minimum of 1 hour of direct supervision weekly and as much indirect supervision as needed to facilitate the delivery of quality services. The guidance document requires 10% direct supervision of student contact and 10% indirect supervision after the first 90 days. 100% direct on-site supervision of SLPAs while they're working with medically fragile students is required. Live e-supervision is not allowed. It doesn't make a lot of sense to even assign a medically fragile student to an SLPA if 100% direct supervision is required. If the supervisor can no longer provide the level of supervision stipulated in the plan, the SLPA may not perform assigned tasks. In other words, they would stop until another supervisor is found and another plan is developed. ASHA recommends that you document all of your supervisory activities, both direct and indirect, and that they must be accurately recorded. A form for documenting the direct and indirect supervision is available in our guidance document. The records of direct and indirect supervisory activities should be maintained for several years. As we talk about the paperwork, it can seem like a lot. We've carefully considered what's required and what you could utilize to document that you did the requirements so that you are protected, the SLPA is protected, and the student is receiving the quality services. So, where do you begin? You may want to consider using the checklist for initial employment of the SLPA. The SLPA may need help in navigating the certification requirements and all the forms they need to fill out initially. This is not a required form, but it may help you remember all the different things that need to be done. Let's begin with the end in mind. You will be turning in the verification report at the end of the school year. With that report, you must attach all certificates of completion or verification of attendance as part of the professional development requirement of the SLPA. In addition, you will attach the form that shows the observations and progress reports of all students assigned to the SLPA every progress reporting period. A critical piece of your supervision is your supervision plan. The supervision plan must be submitted within 15 days of the employment of the SLPA. It is the responsibility of the supervising SLP, the SLPA, and the special education director to collaboratively design and implement a supervision system that maintains the highest possible standard of quality. The amount and type of supervision required should be based on the skills and experience of the SLPA, the needs of individuals served, the service setting, the tasks assigned, and other factors such as whether they're new employees or they are experienced SLPAs. Remember, as the supervisory responsibilities of the SLP increase, the caseload and other responsibilities of the SLP must decrease. The supervising SLP is responsible for the SLPA's caseload as well as his or her own. The supervising SLP and special ed director should mutually agree on the supervisory responsibilities and subsequent reduction of the SLP's workload. The supervision plan includes information about the special ed director, the speech-language pathology assistant, and the supervising speech-language pathologist. It also starts with describing the background and the experience of the SLPA. Next, you would describe the roles and responsibilities of the SLPA. You may want to include a copy of their schedule, of course, leaving out the names of the students they serve, perhaps using initials. The supervision plan section is crucial, and this is where you describe how you're going to supervise this SLPA and when. Both you and the SLPA must review a module. Of course, you're doing that right now, and you would put the date that you completed this module on the supervision plan. Next, you would indicate the number of students on your caseload and the number of students on the SLPA's caseload. Remember, you're responsible for both. Then you would indicate the percentage of direct supervision you plan on providing and the percentage of indirect supervision, your targets or goals. We also need information about the schools assigned to the SLPA and how we could reach those schools. And finally, there's a place for you to indicate your agreement to providing the supervision according to the guidance document requirements, and that you take responsibility for the practice and activities of the SLPA. Direct supervision means on-site, in-view observation and guidance by the SLP while an assigned activity is performed by the SLPA. Direct supervision may include, but is not limited to, observation of a portion of a screening or treatment procedures performed by the SLPA, coaching the SLPA while they're working with a student, modeling for the SLPA with the targeted student, or real-time electronic supervision. This does not include reviewing a taped session. Indirect supervision would include things like record review, review of draft IEPs and progress notes with the SLPA, review and evaluation of audio or videotaped sessions. Your conferences with the SLPA can be conducted by telephone, email, or video conferencing, but remember, not all platforms are safe. FaceTime and Skype are not secure platforms for sharing confidential student information or observing therapy sessions. Remember, the minimum amount of supervision suggested is at least 30% weekly during the first 90 workdays, with 20% of that being direct. The minimum supervision recommended after the first 90 workdays is 20% weekly, with no less than 10% being direct supervision. The amount and type of supervision should be based on the skills and experience of the SLPA, the needs of the students served, the service setting, and the tasks assigned, as well as other factors. So during the first 90 days of, let's say, 35 hours of direct therapy per week, the SLP would supervise the SLPA about 7 hours to reach the 20%, and 3 hours and 45 minutes for indirect supervision, or 10%. After 90 days, the amount of direct supervision can be reduced to 10%. So then it would be 10% direct supervision and 10% indirect supervision. However, remember, this reduction is based upon the SLPA demonstrating independence and knowledge and skills that makes the SLP feel comfortable in reducing the amount of supervision. This is the weekly supervision log that the SLP and the SLPA would complete, recording the amount of time spent with direct and indirect supervision. At the bottom of the form, you would total the number of direct and indirect hours, and you would complete the calculations required to determine percentage of direct and indirect supervision. We have another module that goes through these calculations. It won't take long before you're able to predict the amount of hours you need to spend each week in direct and indirect supervision. However, remember, as new students appear on the caseload or new tasks are required of the SLPA, you would adjust your hours. So know your minimums and, of course, provide those minimums, but more importantly, provide what is needed for both the SLPA and the students they serve. Initially, the SLP may want to use this direct observation form as a teaching tool. It provides a place for the SLP to provide information about strengths and skills needing improvement, as well as suggestions. Using this form or your county's form for the speech language therapy progress note is a great way for the SLP to review the goals and activities and successes that take place during therapy. Services provided by an SLPA are not an allowable expenditure for Medicaid reimbursement. However, speech-language pathology progress notes should be collected as part of the cost settlement, and TCM activities are billable by an SLPA. The next important form to maintain is the direct observations of students assigned to the SLPA. Remember, it will be turned in at the end of the school year with the verification report. On this form, you're tracking two different things. First, you're showing that every 9 weeks you are seeing the students served by the SLPA. And every 9 weeks, you're looking at the progress reports and reviewing them and signing off on them. In order to maintain confidentiality, you would list the student's initials here. Grade or class goes here. You would add comments here, like what the student is working on or what you want to remember the next time you observe that student, or things that you need to check on or assessments you need to do, information that would be helpful to you and to the SLPA. During each 9-week period, you would first indicate the date that you observed the student, and then the date that you reviewed the progress report and signed off on it. Each 9 weeks, you would record the date that you observed the students assigned to the SLPA and the date you reviewed the progress reports and signed off on them. It's important to provide feedback to your SLPA and to document it. First, they need the feedback to grow and to learn as a clinician. But also, this form is helpful to you because you can break down the tasks and responsibilities of the SLPA and determine areas in which you might need to provide more support, and also areas in which you can back off. This will help you determine the amount of direct supervision you need to provide and when. You'll notice that there's a place to indicate the date on which you provided feedback to the SLPA, and that year 1 has a space for post 90 days because it's important after that first 90 days that you determine whether the SLPA is independent enough for you to back off to the 10% direct supervision. After that, you would just indicate the year and then do the evaluation in January and in May. Next, you will see a rating scale along with explanations. A rating of 1 would indicate that you're providing the instruction to the student and you're modeling for the SLPA. 2 is when you're there and you're providing 100% supervision. 3 is where you would have frequent explanations and more than the minimal required observations. 4, you're explaining less, but you're still more than the minimum 10% required direct observations. And finally, 5 is you would provide the indirect supervision and minimum required direct observations. That's the level where you would be at 10% direct supervision and 10% indirect supervision. It's really helpful if you provide specific feedback to the SLPA. Your meaningful comments, your well thought out comments will be very helpful, and you can provide for them information about their strengths and also suggestions for improvements. Something we often don't think about is the feedback that we need from the SLPA. The SLPA is following your goals and your activities, but the SLPA may have questions. The SLPA may need explanations. Maybe he or she doesn't feel as comfortable with a technique as you think they do. And so this form allows the SLPA to pinpoint to you the areas in which they need a little bit more support and also how to support them. Some people learn better with modeling. You show them how to do it in a therapy session, or others want verbal feedback during a session, or discussion after a session, or written directions, or suggestions for resources. And so this scale will help the SLPA tell you what they need and how best they can learn. The SLPA rates each of their responsibilities according to this scale. 1, I am comfortable and I do not need any assistance. 2, I would like more feedback and suggestions from my supervising SLP. So they just need a little bit of help. And 3, I would like more information, I need explanations, and/or modeling from my supervising SLP. The NA, of course, would be in the areas in which the SLPA does not work and is non-applicable. As you can see, there is a space for the SLPA to indicate the type of assistance needed. This is where they would put modeling or verbal feedback or discussions, and encourage your SLPA to be very specific so you can be as helpful as possible. And self-evaluation is also a critical part of learning. Encourage your SLPA to do some self-evaluations. This will help you know their comfort levels and how they see themselves, and also help you provide the information and support your SLPA needs. You may think after a period of time there really isn't a need to provide additional feedback to your SLPA, but I'm sure you know that we never stop learning and we're always growing. And to have a format in which you can discuss skills and knowledge is a great opportunity for growth, not only for your SLPA, but also for you. And finally, at the end of the school year, you submit the verification report along with the attachments. The verification report is the culmination of your whole year. It represents everything that you've done, and it summarizes the amount of direct and indirect supervision that you've provided and the professional development that the speech language pathology assistant has participated in. The verification report is due by June 1st at the end of the school year. Make sure that you complete everything on the verification report. Of course, the top is your basic information, your county, your SLPA's name, your name, and the special ed director's name. Then you start by indicating the number of students on the SLPA's caseload. It may have changed from the fall and your supervision plan to now. What percentage of direct supervision did you provide? What percentage of indirect supervision did you provide? Both of these percentages should be pretty easy for you to know by this point because you've maintained the weekly direct-indirect supervision logs, and all you're doing is averaging those percentages. You check here to indicate that you are maintaining those weekly direct-indirect supervision logs even though they are not attached to your verification report. The SLPA is required to have a minimum of 12 hours of professional development in topics related to communication disorders. The titles or topics of the professional development would be listed here. The date of the professional development would go in this column. The professional development CEU hours and half hours, or 0.5, would go here. After totaling the number of CEU hours and half hours, or 0.5s, you make sure and you indicate that you have included copies of all certificates of attendance. Double check and make sure that you have the verification report completed, that you have your direct observations of students assigned to the SLPA completed for the entire year, and all certificates of attendance. You would provide verification of your supervision by signing and dating the form. The SLPA signs and dates the form, indicating that they have received the supervision that you're verifying and that they have their 12 professional development hours. And finally, the special education director must sign and date the form. As a gentle reminder, you would check to indicate that you have included the direct observations of students assigned to the SLPA form. In summary, you would submit the verification report by June 1st. You would include the direct observations of students assigned to the SLPA form and all certificates of completion and verification of attendance forms are attached, and support or document the 12 hours of professional development required by the SLPA. You would send this report to Leanne Brammer at this address or fax by June 1st. And again, thank you for your support of SLPAs.